So in this video I'm going to talk about vertebral artery. In the applied anatomy section of the cervical spine, my first video, I talk about the upper cervical spine, cervicocephalic area, atlas and axis and their movement and the range of motion. In this video I'm going to talk about vertebral artery, where it starts, travel and where it ends, more about vertebrobasilar system. In the next video I'm going to talk about the lower cervical spine, C3 to C7. Now, vertebral artery. Vertebral artery is just part of the vertebrobasilar system. Now, before I start, I'll say where it starts. So, vertebral artery starts from the subclavian artery, enters the transverse process of the C6, transverse process of 6 cervical vertebrae, travels from C6 to C2 transverse process, and enters into the foramen magnum. Merge with the other vertebral artery and forms the basilar artery. Now, applied anatomy. So, it is responsible for balance and drop attacks. So, start with vertebrobasilar artery. Vertebrobasilar artery supplies the hindbrain, 20% of the blood supplied to the hindbrain along with the internal carotid artery. Internal carotid artery supplies the 80% of the blood supplied to the hindbrain. Now, clinically, vertebral artery divides into 4 parts: V1, V2, V3 and V4. So V stands for vertebral artery, V1, V2, V3, V4. I'll talk into detail. Now V1 is preforaminal. Now what is preforaminal? So V1 represents the vertebral artery which starts from subclavian artery before entering the transverse process in the 6 cervical vertebrae. Now V2 is a foraminal segment or a foraminal part of the vertebral artery where it resembles the part of the vertebral artery between C6 to C2 vertebral artery, where it travels in the transverse process from C6 to C2 along with the vertebral veins and vertebral nerves. Now V3 is extradural and extracranial, where the vertebral artery leaves the transverse process of a 2nd cervical vertebra, turns around to the 1st cervical vertebra, but before foramen magnum, before it pierces to the meninges. In V4, final part, is intradural and intracranial, where a vertebral artery is inside the brain and merge at the base of the skull along with the other vertebral artery to become the basilar artery. Now, in its path, vertebral artery lies close to the vertebral body and the facet joints. So it is more prone for injury because of osteophyte formation in cervical spondylosis or even the facet joint injuries. Older individuals are even at the higher risk because of their age and atherosclerotic changes in the vertebral artery and other vascular risk factors due to age like hypertension, diabetes, high cholesterol level, and even smoking may reduce the significant amount of blood supply or blood flow to the vertebral artery. Now, why we are discussing vertebral artery in applied anatomy? Because rotation and extension of the cervical spine as little as 20 degrees can reduce the blood flow to the vertebral artery significantly. Now, so that is very important before, as a therapist, even if you do the range of motion, manipulation, mobilization of any cervical spine, you should check VBI. VBI is vertebrobasilar insufficiency. The most safest position to check VBI is when the patient is in a supine line. The second safe, if the patient passes the supine, go with the higher sitting position and then check in the standing position. Now, vertebral artery is prone to greater stresses at all 4 levels, V1, V2, V3 and V4. But the later 2 areas like V3 and V4, now V3 is extracranial and extradural and V4 is intracranial and intradural. These 2 areas are at higher risk of VBI symptoms, vertebrobasilar insufficiency. It may be due to thrombosis, dissection of the vertebral artery, and stroke. Let me explain. Thrombosis can be the formation of atherosclerotic changes and plaque formation in the vertebral artery. It may lead to stroke-like symptoms and dissection of the vertebral artery. Now, what is dissection of the vertebral artery? In that, the inner and middle layer of the vertebral artery get separated and will lead to false septum because of a blunt injury to the cervical spine. For example, whiplash injury. Now, according to Dutton, most common non-penetrating injury to the vertebral artery is cervical extension with or without side flexion and rotation. Now, symptoms related to vertebral artery include vertigo, tinnitus, visual disturbances, nausea, and drop attacks. Drop attacks is like falling without fainting. Now, if you see logically, it supplies the hindbrain. Hindbrain has visual centers in the occipital lobe that is responsible for balance, and it supplies cerebellum, part of cerebellum, that is the major organ for maintaining balance. In higher cases, the VBI can lead to stroke and death. Thank you.